Okay, hi guys. For most of you know me in the Fibro page, I'm Lana. I'm your fly by the seat of my pants admin. um, we're very, very lucky today to have Dr. Eleanor Stein talking about neuroplasticity with us today. Go ahead, Dr. Stein.
Okay, welcome. So for those of you who don't know me, I think maybe I'll just give a little bit of an introduction. So my name's Eleanor Stein. I often go by Ellie when I'm not in trouble. I've been in medical practice for 35 years. It's quite scary to think of that. I retired. So I was practicing, I'm a psychiatrist, and because of my own illness experience, which I'll share with you a little bit, so you kind of know where I'm coming from, I spent the last, basically since 2000, so 23 years, devoting my entire medical practice, reading, research, etc., to myalgic encephalomyelitis, fibromyalgia, chronic pain, chemical sensitivities, and then more recently, long COVID. So how did I get into this? I wanted to be a psychiatrist, and I actually trained to be a child psychiatrist. And in my second year of residency, I'm sorry, I'm just going to mute people who I notice might have accidentally unmuted.
Yeah, for sure.
Even Lana, I'll mute you, but you can unmute yourself whenever you want. Okay. Oh, there's another one. So how I got into this, I had no intention of this field. I had never even heard of it. In my second year of residency, I became ill with what I now know is chronic fatigue syndrome, fibromyalgia, chemical sensitivities, hypermobility. So I think for me, that's kind of behind a lot of the pain that I was experiencing. Low blood pressure, POTS. I think along the way I've developed MCAS. I've had some encounters with Lyme disease. So you can kind of, I call it now the alphabet conditions, like all of these things have abbreviations. So I pretty much had the whole alphabet. And I'm fortunate in that I wasn't in the most severely ill category. I was never bedbound, for example, but I was unable to work for a while. And once I slowly started learning and experimenting with how to help myself function better, I returned to work, but I've only ever worked part-time. So I struggled along, moving to Calgary at that time in 2000, making the decision that I was going to devote my career to this field because I had tried to get help. Remember, this was 1989. There was no help. I literally had met two people in Canada, physicians who kind of maybe knew something. And so I figured the universe had presented me with an opportunity. So really since 2000, I've just devoted myself to learning as much as I can, partially to help myself, and of course, then partially to help all the patients that I worked with in my medical practice, which for those of you who just joined, I retired from at the end, a year ago now, at the end of 2022. And now I'm, as you can see, not fully retired. I feel like I've been incredibly fortunate in that despite having all of these health problems, I've been able to still work. I've been able to still learn. And I feel like now it's kind of my time to give back and share what I've learned with others. You know, one-on-one is great, but there's literally millions of people out there who want and need more information. So that's kind of what I'm devoting my time to now, as well as travel. Some of you, if you go to my website, the web address is on the slide. I guess I shouldn't have the screen share on right at this moment. Whoops. Anyway, if you look at the slide, you'll see my web address. And if you go to the, I think it's the About Me tab, there's a drop down, and the bottom thing is Ellie's Travels. So one of the reasons I retired is so that I could have a better work-life balance and so that I can travel, because I can't run a medical practice unless I'm in Calgary, but I can do talks like this, and I can still be learning and writing and doing my tips of the month and things like that, no matter where I am. So this year I've been away for about 6 months, and I've used my Starlink to kind of keep things going. And you'll see some of the photos from my travels on my webpage. So I'm gonna dive right in. Whoops. Okay, so I'm gonna start by sharing, by helping you, by giving you some context and kind of helping position you so that when I talk about neuroplasticity, what it is and how to use it, you'll have an idea of whether what I'm saying applies to you. So I created what I call the neuroplastic symptom assessment. It's 12 items that describe or ask you some of the features that are typical for chronic pain and other chronic symptoms. Acute symptoms are different than chronic symptoms. So for example, sorry, I'm just muting people as I see fit, using my awesome powers. So just to focus on pain for a minute, acute pain feels very different and has different associated features than chronic pain. And I'm going to explain in this presentation why that's the case. But I first want to kind of help you figure out whether what I'm talking about pertains to you or not. So I'm going to tell you the 12 questions, and then I'm going to give you a link so that if you want to go back and look at it, you can. And if you go to the link and you fill out the 12 questions, it's going to kind of register you for a little email follow-up, which provides you with more information. So since your symptoms started, do cold temperatures make your symptoms worse? So yes or no. Does sustained and repeated stimulation, heat, cold, pressure, muscle use, so contraction meaning you're using the muscle, cause your symptoms to worsen? Does light touch, either to an area that's painful or even to an unaffected area of the body, feel painful? Right? In a healthy person, a light touch should feel pleasant. Is your mood more irritable or depressed? Do emotions make your symptoms worse? Are you more sensitive than other people to things like light, noise, touch, sound, or smell? Are you clumsier than you used to be? I see some smiles. Do you have less clarity about where your body is in space? So for example, if you try to touch your nose with your eyes closed, can you do it? Or do you miss your face? Do your symptoms move around? Does heat make your symptoms feel better? Do you have fatigue, either kind of brain fatigue or muscle fatigue? And do you have brain fog, or what we call fibro fog? So if you have, so this is the link if you want to kind of do the assessment formally, and then you'll get an email with your score, and then you'll get a couple follow-up emails telling you what each of those symptoms mean and what the answers mean. So if you, as I was going through it, answered yes to 4 or more of those symptoms, then what I'm going to be talking about for the next 20 or 30 minutes is going to apply to you, because those are symptoms that suggest that your brain is involved in your problem, like in your disorder. So diving right in, what is neuroplasticity? Neuroplasticity is the ability of the brain to change in structure and function. I'm going to talk what both of those mean in response to experience. So that means whatever you're doing in any moment, what you're thinking, what you're feeling, and actions or behaviors that you're doing is constantly rewiring your brain. When I say structure, if you look at this diagram, which is an image of a dead person, right? An autopsy brain, where they dyed the different brain pathways, different colors. This is what the brain looks like. There's these actual physical things that are pathways. Sorry, just again, putting a mute on. Actual physical things that are pathways that change in every moment based on what you think, feel, and do. And as soon as the pathways change, your brain functions differently. So in the brain, the structure and the function are totally connected. There's no way to dissociate them from each other. How does this happen? How does the brain change, and how does it know what changes to make? This is due to neuroplasticity. And the first and biggest law of neuroplasticity is what fires together wires together. So that's basically just rewording what I said before, that whatever you think, feel, and do, the neurons actually send out little tendrils and they reach out to each other. And as soon as they find another neuron that's firing at the same time, it makes a connection called a synapse. Now you've got a new neural connection. And if you do it a whole bunch of times, more and more and more neural connections will be created. So I'm going to explain how I believe chronic pain and many other chronic symptoms develop. How does it happen? I want to start by saying this is totally below our level of consciousness. So it is absolutely not your fault if you have pain or other chronic symptoms. It's just how the brain works. And then this slide is a little bit sciencey, so bear with me. But probably you're going to want to know, have like an understanding of how could this happen? Why after my fall, my surgery, my accident, my pregnancy, my car accident, why did I get chronic pain? And maybe some other people didn't, right? Whoops. Okay, so this goes back to Pavlov. Pavlov lived about 100 years ago in the 1920s. He was a physiologist in Russia. He was researching dogs. I'm not going to describe the experiments because they did very horrible things to the dogs. But this part, no bad things were done to the dogs. So you start with a stimulus. In the case of the dogs, it's food. So you put food out for the dogs and the dogs salivate because the dogs smell the food. It's an unconscious brain pathway that triggers salivation to ready the digestive system to digest the food optimally. In the beginning, before the conditioning, if you ring a bell in the lab where the dogs are living, nothing happens, right? Other than the dogs might look at the bell, but it doesn't have any effect on their digestion. Because for a dog, a bell has no association with food. Then they conditioned the dogs. And what that means is they brought food and they rang the bell at the same time. And they did that repeatedly over many days. And of course, the dogs weren't doing anything on purpose. They're just showing up, and the bell and the food are happening at the same time. And after a period of time, when they rang the bell, the dogs would salivate. So now the dog's brain, at an unconscious level, through no fault of their own, was associating the bell with food. Now, what I think happens in chronic pain and some other chronic symptoms is that you have a trigger event, an emotional upset, a physical injury, an infection. there's a huge long list of the triggers. Probably each of you had different things that triggered your own fibromyalgia symptoms. So the trigger happens, the trigger causes symptoms. Say, just for the sake of ease, you had some kind of injury. Say you broke your arm. And now it's going to take 6 to 8 weeks for that arm to heal. And during that time, you're going to experiencing some pain. In some cases, and we have some hints about why this happens, but I wouldn't say we could ever say why in a certain person it happens. The trigger and the symptoms become connected with each other, hardwired in the brain. And now, even after the arm heals, which happens in about 8 weeks for most major injuries, whether it's a surgery or a broken bone, the brain is still thinking that something that reminds you of the trigger. Maybe you fell doing a certain activity, and the brain has hardwired that activity with the symptom. And now, if you think about the activity, or you do something similar to the activity, even though you're not breaking your arm again, you're perfectly safe, the brain has made that unconscious conditioning that connects the two. And now every time something happens that's in any way reminding your brain of that situation, the danger alarm goes off and it triggers symptoms. So when we have symptoms, it's because the brain thinks we're in danger. If the brain thinks we're safe, you could be in a fire and you won't have any symptoms. So we often think of pain as being caused by a body part, like, oh, my arm's sore, my leg's sore. And we think that the pain signals come from that body part up to the brain and tell the brain there's a problem. But actually, that's not true. What happens is signals, what are called nociceptive signals, come from the body part, say the arm. They come and they say to the brain, I think there's a problem, there's pressure, there's heat, there's temperature change, whatever. The brain then has to discern, are we in danger or not? And the brain only generates symptoms like pain if it judges that we're in danger. And this slide helps me explain that a little bit more. So many people develop fibromyalgia after a car accident. That's been at least my experience in practice, with thousands of patients. An interesting observation was made comparing whiplash injury. So whiplash is when you're hit from behind and your neck kind of snaps back. Of course, sometimes that can be very severe. But the thing about whiplash that has the medical field all confused is that sometimes the injury doesn't seem that severe, and yet the person has really severe symptoms that last for a long time. So there's always this thing in medicine where if in doubt, blame the patient, right? I'm sure all of you have been through that very wonderful experience. But just think about this for a minute. So people can have a relatively minor whiplash injury. They can experience a lot of pain, like headaches, body pain, neck pain. It can even expand to have other symptoms like sweating and rapid heart rate. These are all symptoms of danger, symptoms that the body unconsciously produces when it thinks we're in danger. We want to be in fight or flight because if we're in danger, we better get out of there quickly. But someone observed that drivers of demolition derbies who are on purpose crashing their cars really, really hard and are finding it fun, so they're doing it voluntarily, on purpose, they don't complain of whiplash. Why is that? And so one of the ideas is that our beliefs, our mindset, our emotions, that's where kind of the mind comes into this picture. So I'm not saying that in all cases, the mind is involved. Sometimes you have an injury or an illness or an accident, and there's not a lot of emotions involved, but for whatever reason, the brain just hardwires things connected with this accident with danger. But sometimes, like one of those 12 items, one of them was, do strong emotions make your symptoms worse? Because we know that sometimes that is the case. And it's because how does the brain judge when it's in danger? So you have the signal coming from the previously broken hand coming to the brain. It could be a minor signal, but because the brain is now conditioned that anything coming from the hand is evidence of danger, it could generate pain. But other things, like they've done experiments where they filter a bad smell into the lab, like burning flesh or something like that, and people's pain levels go up, right? Or you put a caution signal, you put yellow tape in the lab, they do all these things to kind of trick people to see what their brain is subliminally picking up. So any of these signs that are just representing signs of danger, and it could be danger from the present or danger from the past. So this is where things like unresolved trauma comes into the situation. People who have been unfortunate enough to experience trauma, unfortunately, their brain has hardwired that the world is a dangerous place. And we know a lot about that biology. There's been a ton of research. So what that means is the trauma might be 20 years ago, but now you're in a situation with chronic pain. Unfortunately, if you've had trauma, you're more vulnerable because your brain already is more likely to assess a situation as being a sign of danger. So given that kind of explanation of how the symptoms might develop, the next question is, well, what types of symptoms does the brain play a prominent role with? And this is the real answer to that is almost anything, right? Our brain is kind of in control of our whole body. So almost any symptom could be impacted by the brain. But in my experience, certain types of symptoms are more impacted by the brain and are more likely to be remediated by the strategies I'm going to share with you. So the list of symptoms on this slide are the things that if you have them, there's every reason to be very hopeful that you could make a lot of improvement using neuroplasticity-based practice. So perceived tissue damage, if you're more reactive to that, if your body has become very sensitive to little signals coming from your body and it's interpreting them as danger, it's going to create chronic pain or generate chronic pain. Other people don't have a problem with pain. They have a problem with chemical or sensitivity in other senses. So people whose brain is has become sensitized to smells, same thing, right? People have an initial toxic exposure to smell, which cause symptoms. Their brain hardwired the connection between the trigger and the symptoms. And now that person has another exposure to that smell, maybe at just a tiny amount that's not at all toxic, but because the brain has made that hardwired connection, it thinks, oh my gosh, this is sign of danger, and it generates a whole bunch of symptoms. For people that have become stress sensitive, they could be more vulnerable to symptoms of depression and anxiety. For people that have become sensitive to sound, there's a condition called tinnitus or tinnitus, where you get constant ringing in your ears. And it was a big shock to me a few years ago talking to a very educated audiologist who explained to me that tinnitus is actually one of this group of symptoms that the brain plays a big role in. So the good news is if you answered yes to a lot of those 12 items, and if you have some of the symptoms that I just listed on the last slide, there is hope. And I'm going to now spend the next 10 minutes or so explaining kind of the bare bones of the approach that I've developed to help people with these kind of symptoms. So in our brain, we have, believe it or not, 100 billion neurons. Well, actually about 90 billion. They've revised it down in the last couple of years. Those 90 billion neurons, each one of them has made connections with about up to 10,000 other neurons. That's how complex our brain is. So that means every single neuron is part of thousands of different pathways. So the same neuron could be involved in a pathway to do with emotions, a pathway due to movement, a pathway due to vision, a pathway due to executive function or planning. Our neurons do many, many things. But the key is that they can only do one thing at a time. That's just how neurons work. So after a neuron fires, it produces an electrical signal, and then there's a period of latency where it has to kind of recharge before it can fire again. So what this means is that in any given moment, when I'm experiencing a symptom like pain right now, I have a choice. I can go down the same path and respond to the symptom in the way that I always do. And that will fire the neurons that I've been firing for a long time, sometimes years or decades. And if I'm keeping my neurons busy processing pain and misery, because pain and misery often travel together, my neurons are going to be busy and they won't be able to learn new behavior. If, on the other hand, I make a decision that I want to change my life, and every time I have a symptom, I decide to try something new, ideally something that is more aligned with the life that I want to be living. I'm keeping my neurons busy doing those activities, and they can't at the same time process pain. So it sounds very simple, but it actually is true based on the biology of how neurons work. So I call this strategy active redirection. So what I've defined it as to use every awareness of your chronic symptoms. So for you having fibromyalgia, that's going to be pain, fatigue, unrefreshing sleep, brain fog. Some people are also going to have like numbness, dizziness, all bunch of things, right? So every time you get a symptom, you can change it from your nemesis to your ally. So I know for me, before I learned this, every single time I would have a symptom, which is almost all the time, I would just feel defeated. And I would do the exact same things that I had always done that weren't working, but I didn't know any other way. Once I learned about neuroplasticity, which for me is about 10 years ago, every time now I have a symptom, I think to myself, what can I do in this moment that's going to keep my neurons busy, that I enjoy, because there's no point in doing something that I don't enjoy. So something that's going to elevate my mood, that's going to be fun, meaningful, or creative. And that, because it's keeping my neurons busy, will actually override my symptoms. If I keep my neurons busy doing something that's really fun, my danger alarm turns off, and the brain, thinking I'm safe, stops generating symptoms, because symptoms are the brain's way of getting my attention. So I'm going to give you a few examples of how this works. Like, what could you actually do in the moment? And of course, this is an unlimited strategy. The only thing holding you back is your own imagination. The beauty of this strategy is it costs no money. There's no tolerance, no withdrawal, no appointments, no explaining to healthcare professionals what you need who don't understand you, etc. This is all within your control. You can do it 24/7, anytime that you think of it. So it's good to have a whole bunch of strategies because we're in different situations at different times. two of the strategies here, calming sense and soft touch, are ideal for the times when you're so tired, your symptoms are so high, you can't do anything very inspiring or active, right? You're kind of beaten down. Maybe it's 2 a.m, your pain has woken you up. You're feeling horrible. So those are the situations where you'd want to do something very easy and nurturing. So soft touch could be a warm heating pad. It could be a soft blanket. Some people carry a smooth rock, pebble or rock with them to kind of, it just feels pleasant. So something that's very simple that gives your brain the message that you're okay. Calming scents, the most popular is peppermint. Peppermint actually has a biological action. It turns down substance P. Substance P is a neurotransmitter that's elevated in fibromyalgia. So a lot of people find when they're experiencing pain and they dab a little bit of peppermint oil near their nose, it smells nice. So it makes you feel safer and calmer, but it actually also affects the biology of FM. Visualizing is thought to be a very powerful modality. So you might imagine, for example, that when you're in a lot of pain, it's like your brain is on fire, right? The danger alarm is going off. It's a loud siren. There's flames. And you could visualize or imagine that you've got little fire hoses and you're putting out the flames, or you're putting a heavy blanket over the alarm so you can't hear it, right? And you're just calming everything down in your brain. Self-talk is very important because, so I got ill in 1989. It's now 2023. So that's a really long time ago. I've been ill for 35 years. So you can imagine I developed some very choice self-talk that wasn't very helpful to myself. I've really, really, really worked on that, because if I am not compassionate to myself, if I'm hard on myself, research shows that that actually activates the fight and flight system, the sympathetic nervous system. Whenever that happens, the brain goes, oh, we must be in danger. Why else would you be in fight or flight? So I want to give myself messages that are reassuring and hopeful, even if I don't quite believe them yet, because when I started this whole process 10 years ago, I was extremely skeptical that any of this would work. Exercise, I know, is a fraught topic. Many of you can't exercise barely at all. Maybe some of you can do a little bit. But just to say, for people who can exercise, it's beneficial in many different ways, including that exercise increases the production of a growth factor called BDNF, brain-derived neurotrophic factor, which allows neuroplasticity to occur more better. So if you can exercise, it's definitely worthwhile. Obviously, staying within your energy and pain envelope so that you don't lead to a crash. And lastly, we have empathy. So how I would define this is basically getting outside of myself. So when we have been ill for so long with so many debilitating symptoms, we may, I'll only speak for myself, become kind of self-focused, because I'm just so focused on how can I feel better. And so again, research shows that if I can actually get outside of my own misery and focus on somebody else and empathize with their situation, it changes my brain. So I've created a program which has these 4 components, which I think if people practice these 4 things each day, they have a good chance of success. The first is to practice things that help you feel calm. Again, because we're trying to turn off the danger alarm system in the brain, the amygdala. To schedule time on purpose to do things that make you feel safe. So the difference between, because calm and safety, often people might go, well, what's the difference? Calm is often something you can do by yourself. And most people feel calmer when they're alone because they don't have to interact with others. So that would be things like paced breathing, meditation, etc. Safety, people often feel safer when they're in the presence of others. This, of course, is highly individual because people who have experienced trauma may have a very different experience. But for many people, a safety activity would be calling a good friend, somebody who's empathic and understanding and validating. It might be going for a walk with somebody, playing music, so doing something that brings memories and feelings of safety. Active redirection, the slide that I've just described to you, all those kind of strategies that you put into place as often as possible when you experience a symptom. So imagine that you become aware of your symptoms 100 times a day. And imagine if 90 of those times you made the decision to do something different than usual. How many new brain pathways you would create and how quickly your brain would change and your brain would go, oh, we're fine here. We don't need to keep generating these symptoms. We're just going to relax. This is your brain talking, your amygdala. Now, the last piece of this is life goals, because you could, meditate for a gazillion hours a day, actively redirect 500 times a day. But that's not actually most people's goal in life. Most people have the goal of getting their life back, right? Being able to do more activities, be a more active parent, go back to work, get back into the outdoors, or doing hobbies or activities that you used to enjoy. So I think it's important a few times a week to put time aside for activities that might be baby steps in reapproaching or creating a new life that you want. In one of the groups that I ran for a few years, we called this creating your designer life. So you had a life, the life has been interrupted by your illness. Most people, when they came to me, they said, I want to get my old life back. But actually, I want to give you the opportunity to really think if that's what you want, because when most people think about it, they don't necessarily want their life back exactly the way it was before. And having an illness that puts involuntary pause. So the downside is you've gone through a lot of loss, but the upside is it actually gives you time to think about what do you want. And to, when I put life goals as an activity, what are the life goals that you want to work towards? As opposed to the life goals that other people think you should be working towards, right? So this is an opportunity to really think, what do I want? What will make my life more fun or meaningful? So to sum up, each time you notice a symptom, engage in something that's different from your usual response. So this is it's simple to say, hard to do, because it takes some time to first observe your usual responses, maybe make a list of them, and then maybe on the other side of the page, make a list of what you could do instead. It's very hard to think of it in the moment. So people have much more success if they have a list of strategies or activities that they want to use as substitutes. If you don't have anything to substitute for your usual behavior, you'll just continue down the same path. So you want to start practicing the life that you want to develop. Say you want to get back to a musical instrument that you used to play, but it causes you pain. Maybe you would start by just listening to music. Maybe you would start by watching someone else play music. Maybe you would then progress to practicing for 5 minutes or 3 minutes, right? Just little baby steps to see what might be possible. And as you practice, my experience is you can slowly take more and more steps and get closer to that activity that you enjoy. The things that you're going to do on purpose differently than before, whether it's the calming, the life goals, the active redirection, or the safety should add up to about an hour a day. Research shows that's the amount of time you have to practice new things to learn them. And learning is just our everyday word for neuroplasticity. So take-home messages. We have much more influence than we might think. I know when I became ill in 1989, the narrative out there in the world, there was barely any narrative, but the narrative that I did find was uniformly pessimistic. Like, these illnesses are for life. There's nothing you can do. So sad to be you. Have a good life. Some doctors still give that message. It's wrong. Because since I've been learning neuroplasticity myself, my health has improved significantly. And since I've been teaching it to others, they're making significantly more progress than they were before. So it is possible to rewire your brain. There's just thousands and thousands of studies showing that is the case. The more we practice, the more we improve. So to some degree, it's in your hands. Of course, we don't have control over everything. Some people practice really hard and make amazing progress quickly. Some people practice really hard and have more modest progress, right? So we're all different. We all have different challenges in our lives and comorbid conditions and life circumstances. But in general, all that being the case, the more effort we put into this changing and substituting the new for the old, the more change you're going to notice in your health and probably your mood as well. And what I recommend to people is that although almost any symptom is modifiable to some degree, chronic pain, sensory sensitivities, anxiety, and depression are what I call the low-hanging fruit. So if you have any of those symptoms, and presumably you all have pain because you're in a Facebook group for fibromyalgia, you're in luck, because that's one of the symptoms that really responds to this. This is a link. So I just, before we started, emailed my helper to say this is a really horrible link because it's very complicated. So I apologize for the complexity. But if you go to this link, I have a free handout on neuroplasticity, which lists some of the principles I've talked about and probably a few things I haven't mentioned today. If you want to learn more, this would kind of be maybe the next step. So now I'm going to go back to the questions that are already in the chat. So would tapping be included here? I'm not sure what that refers to, but I'm assuming it's the active redirection. I would say yes. So I'm myself not super knowledgeable about tapping, but I have had many, many patients who use it and find it helpful.
If I can just step in here to answer that one.
Ahead.
I have done a little bit of tapping, and it falls totally within the active redirection, as well as the soft touch and the calming and whatnot.
Yeah, because it's calming, it's rewiring the brain, right? Tapping often has, I think it's often trying to utilize different parts of the brain or both sides of the brain.
Yeah.
And then there's a calming aspect, I think, through acupressure points or something. Am I kind of close? Okay. Yeah. Not my area of expertise. What about hypnotherapy? So, you know, I'm going to be giving a free webinar on a week from today at 11 a.m. Mountain with a colleague who's a hypnotherapist. So he's from the UK. And he is a really skilled hypnotherapist. So we're going to be talking about stress. And I'm going to be talking about how to shift our mindset about stress. He's going to be talking about a strategy he uses to help people, I guess, manage stress or respond to stress. You might want to come to that webinar and ask him that question, because he's also in the ME/CFS space. And so he might be able to answer it better than I. My thought is that self-hypnosis could be quite helpful because it's something you can do whenever you want, right? So my whole approach to illness is self-management, because I've been in the field for 35 years. I've seen a lot of approaches or protocols come and go, right? It was this was going to be the answer, that's going to be the answer. I'm old enough, I have the white hair to prove it. None of the things that are external really work sustainably over the long term. So for example, to use FM as a specific example, most people are on some kind of pain medication. It's fine. I'm a doctor. I've prescribed thousands, tens of thousands of prescriptions in my life. It absolutely serves a role, but it won't help you rewire your brain, right? So when you stop the drug, the underlying illness is still there. That's why this is so beautiful, because you're actually changing the unconscious conditioning. If you think back to that slide with the dogs, the brain has wired, without your awareness, some connection between triggers, emotions, and behaviors. And now whenever you experience any of those, the brain thinks you're in danger and it generates symptoms. No external thing like a drug, an injection, physio. I got myself in big trouble. I was talking to a medical audience and there was a lot of physios. And I said, I'm not a big, I go to a physio. I have an amazing physio. But in terms of chronic pain, it's not a long, it's going to cost you a lot of money because you have to keep going back, right? If you can convince your brain that the danger is past, it can rewire, and you don't have to pay any money or go to any appointments, and you can actually use your time and energy to have fun. Would this work if you have other conditions with, so that's a great question, Catherine, and let me give my best shot at this because I've thought about it a lot. I've been asked it a lot. So fibromyalgia is kind of now considered the poster child of a new category of pain disorders called nociplastic. So in the past, before 2016, there was acute pain and neuropathic pain. And it was really confusing. We assumed, well, fibromyalgia is not acute pain, so it must be neuropathic. And some of you who are quite knowledgeable will know that there's some research showing that there's a small fiber neuropathy in about half of people with fibromyalgia. So people started thinking to themselves that they had neuropathic pain. Now, neuro means nerve, and pathy means there's something wrong with the nerves. So I worked with a ton of people who thought there's something wrong with my nerves. If you think there's something wrong with your nerves, you believe that there's no hope, because nerves don't regenerate very well or very quickly. It's pretty slow and incomplete process. So I think that categorizing FM as neuropathic fed into this pessimism. Now in 2016, the International Association for the Study of Pain changed all of their categories based on decades of research. And they made this new category called nociplastic. So noci means ow, right? Someone just jabbed me with a sharp object. That's noci, noxious. And plastic refers to neuroplasticity. So they've now created a whole category of pain, which is basically explaining everything I've just shared with you, that you can go from this acute ow state to this chronic state, and it's caused by neuroplasticity. And if you go to any of the papers that were supporting this new category, they're all about fibromyalgia. So fibromyalgia basically is now this new category of pain, which is saying it's real, it's measurable, you're not making it up, and it's caused by neuroplasticity. And the International Association just leaves you there. Like, oh, too bad, so sad. You've got this pain. But they haven't said anything about how to solve it. And so what I'm saying is there's nothing wrong with the nerves, more or less. That's a complicated, nuanced discussion. But most of the pain is not caused by a problem with the nerves. It's caused by the neural connections, the pathways that have been formed over time, which we can undo. So that was a long introduction to the answer to the question. I'm known for that. So something like arthritis or spinal stenosis, I'm going to answer those two slightly differently because they're different conditions. So arthritis is a situation where, say you have an arthritic knee, it's the bone actually gets bigger, right? The bone gets bigger and it cuts into it rubs wrong and the cartilage gets broken down. And now when you use it in certain ways, you've got an acute pain. Ow. That's the nociceptive signals are going from your knee to the brain. But what also happens, and there's a lot of research to show this, is, so I'm going to call that like a primary acute pain. Neuroplasticity isn't going to help you with the problem. It's not going to help you with the arthritis. It's not going to make the arthritis go away. So every time you move your knee in a certain way, nociceptive signals are going to travel from the knee to the brain. But what can change is when those signals get to the brain and the brain is going, what does this signal mean? Is the owner of this knee in danger? If every time you feel that knee pain, you use calming or active redirection or safety activities, you can let the brain know that you're aware there's a problem, you know that you're not in danger, and you've got strategies to deal with it. You might ice it, you might, change your activities up a little bit, but you're not going to die, because the fight and flight mechanism that's generating the pain thinks you're going to die. It thinks a saber-toothed tiger is at your door, right? You have a sore knee, but you're not going to die. It's uncomfortable. There's that uncomfort is probably not going to go away, but I call it like an onion. So there's all this secondary conditioning that happens over time when you have an arthritic knee, that the brain gets more and more worried about this problem because it hasn't found a solution. And you're getting more and more frustrated. God forbid you're on a 3-year waiting list to get your knee replaced or something like that. So there's a lot of thinking and emotions that can ramp up that pain and add to the actual nociceptive signals that are coming from your knee. And my experience suggests that you can take some of those additional layers off the experience. So you still have arthritis, you're still going to have some pain, but it doesn't have to be as severe. Spinal stenosis is a little bit of a different category because it's so, it's horrible. It's horrible and painful and affects so many other aspects of function, right? Like bowel and bladder function and leg function. So I would say that the same theory would apply, that you probably have the symptoms that are actually being caused by the tissue pathology. And then for most people, you're going to have these added layers that have been generated by the brain because it's working itself up into a lather. And it may be possible to change some of those secondary symptoms, but you're still going to have the underlying problem. It's not magic. You're changing your brain, not your body. Someone's asking, do I see patients? No, I retired. So I see no patients. Oh yes, this is a great question. Again, to Catherine. Do I think fibromyalgia falls under functional neurologic disorder? I'm just going to make a big sigh. So the problem with certain terminology is that some terms have been badly used and have developed unfortunate connotations. And for me, The term functional neurological disorder is one of them. So if we pull back all the layers of how that term has been misused to blame patients for their own problem, yes, at the most basic level, chronic pain in general, including fibromyalgia, is a functional neurological problem. Functional meaning it's the function of the nerves in the brain that are causing the problem, and the nerves themselves aren't damaged, kind of like I described before, why I'm so glad they're not using the neuropathic pain anymore, because it was very misleading. But the problem with this term is that for the last like 50 years, the word functional has been used to invalidate patients, to say your problem isn't real and you should get over it by thinking differently. So for that reason, I never use this term. I never use the term functional neurological disorder, functional somatic syndrome. That's the one that in the ME field we get all upset about, because I'm worried that if I use it, even though I know what it means, someone else might misinterpret it as meaning that the patient is just, if anyone who's gone through depression, it's not just, but is depressed or not trying hard or thinking badly. I believe none of those things are true, but I believe it is true that we can change the function of our brain. We know that is true. I don't know if that answers the question. Yeah, thanks, Catherine. So anybody else, you can also feel free to just turn your mic on if you want to ask it verbally. No, there's usually way more.
Can I ask a question about specifically more about the heat aspect that comes with in my particular case, fibromyalgia and some other diagnosis that my doctors are working on. I don't know, whatever. But the heat, is that something that can be turned around with, for lack of better term, positive thinking and redirecting and those kind of things? My biggest symptom is my heat.
That you feel too hot.
Hot.
Got it. How? I won't ask a private question, but you know, at a certain age, women do feel hot.
Yeah, done that long time ago.
Got it.
Yeah.
Well, here's a really cool research fact that I found, and this was in like the a very conservative, you know, highly technical journal, and it just blew me away. So it basically said, so there's a theory with ME/CFS and fibromyalgia that there's an element of neuroinflammation, meaning there's actually some heightened immune activity in the brain.
Okay.
So one of the key researchers on that is Jared Younger, and he's at the University of Alabama. And I actually have a video on my website of him because he did like a webinar for me like 10 years ago. But you can go online, you know, he's still working in the same field. And I just watched one of his, like in the last year, kind of an update. Unfortunately, mostly the update was sharing how difficult it's been for him to get the research going. But he's developed this really interesting imaging method that shows that in ME/CFS and FM, there's inflammation. So he's literally measuring temperature inside the brain. I mean, it's very cool.
Okay.
Now, the article I read, which is still mind-blowing me, says that you can change inflammation through neuroplasticity. So in theory, okay, I'm pretty conservative. For any of you who know me, I don't like make big promises, right? So in theory, you can use neuroplasticity to change biology like heat.
Okay.
So all I would say is try it.
Right.
Right?
Right.
No promises. like I've worked with a bunch of people over the last 10 years. No, I can't think of someone with that specific question. So I would just say try it. And if you have some success, definitely let me know.
I will, for sure. Okay. Thank you.
You're welcome. Any other questions before we wrap up? So I don't know what that means with no questions. Does that mean you didn't understand what I shared? Does it mean you don't believe a word of it?
I think you've explained everything very well. I'm just checking
the Facebook clear that you're left with no questions.
I'm just checking the Facebook page now to see if anybody there has questions.
Okay.
And for me, I don't have more questions because I think I'm processing.
Yeah.
It's the information you've shared with us is so interesting and hit home on so many different levels that now my brain is going tickety, 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 tickety.
Yeah, I know. Yeah, it's pretty mind-blowing, right?
It is. It really is. And to think that we can get some relief by something, quote unquote, as simple as changing our thought patterns.
It's more than that. Okay. So someone used the word positive thinking. I think it was you, Lisa.
Yeah.
So I just want to be crystal clear.
Okay.
Positive thinking positive thinking alone will not be enough.
Okay.
Okay.
Yeah.
So you have to change your habitual thoughts, feelings, and behavior. So if you don't do anything different, but when you experience pain, you say, oh no, I'm good, it's all fine. Your brain is not stupid. It's not going to buy it. It's like, no, you're not fine. There's like extreme pain going on here. Right. So you actually have to do something that takes focused attention. I forgot to mention that part, because only with focused attention are you keeping your neurons busy.
Okay.
So just thinking is important. It's necessary, but it's not sufficient.
So just to clarify, I could get up and just walk around the house. That's something like changing it. Instead of sitting there and thinking about, oh, I'm in pain, what can I do? Get up and walk around. Get up and wash my face.
Walk around, put music on, call someone.
Wash my face. Do something
Plan a project in your head. Anything that gets your mind onto something else.
Thank you.
Yeah, you're welcome.
Thank you.
I see a couple more questions popped up. In addition to fibro, I've been diagnosed with autonomic dysfunction. Yes. Okay, so Tammy's question. I am going to say I don't know. If you go, so there's a lot of neuroplasticity coaches or courses out there. It's the trendy thing right now. There's lots of them. And many of them promise that you can heal from POTS, postural orthostatic tachycardia syndrome, for people that don't have POTS and have no idea what we're talking about. So basically, autonomic dysfunction means you have a difficult time maintaining your blood pressure, your blood pools to your feet, and when you stand up, you feel dizzy and nauseous, and you probably pass out and your heart rate goes really fast, and it's a bad scene. So I myself have POTS. I have a connective tissue disorder that is genetic and is not going to change no matter how much neuroplasticity practice I do. So I'm skeptical of the people that claim that you can cure POTS. It's like the arthritis question. If I have an arthritic knee, I can practice all I want. It's not going to go away. What might go away is how my brain interprets the signals coming from the knee and how many symptoms it feels that it needs to generate to get my attention. That can definitely be molded or changed, but the knee itself isn't going to change. So with most people with autonomic dysfunction have lax connective tissue, and no amount of practice is going to change that. That's just how we're born, right? It's like if you're born and you're 5'8" and you're like, I'm very optimistic I can become 5'10" through practice. It's not going to happen because we've got a genetic blueprint that isn't going to change. What we can change is our genetic expression, right? So our genetic expression is which genes are turned on and off in any moment. That's a whole other fascinating area. That's what we're changing through neuroplasticity. So if all my life I've been turning on my fight or flight genes, and now I practice a lot and I calm that whole system down and I'm no longer turning on those genes, now there's an opportunity to turn on other genes that might be more beneficial to me. So we can change a lot, but not hard, genetically determined traits. What are the best steps to take to learn more? So the link that we put in the chat, the FM-AB-FB- February 6, 23, is going to take you to a page where you can get a free handout, which is called something to the effect of 7 surprisingly simple steps to living with less pain. So it's kind of just a different summary. You know, sometimes you read things differently. You go, oh, I get it. So it's just an 8-page handout summarizing some of the stuff I've talked about. I've got a bunch of blogs on my website. So if you go to my blog page and you type in pain, you'll get more information. If you do the neuroplasticity assessment that I shared with you towards the beginning, I suppose I could just put that in the chat as well. Just one sec. I'm just going to put the pain assessment in there. So all of them kind of are ways into getting more information. And then if you really want to dive in, I have a very comprehensive online course called Healing Through Neuroplasticity. And you would just go to the store on my website, and my website's in a little bit under construction, so bear with me, but all the information there is there describing. So everything I explained to you today, plus a lot more. I'm also working on a less comprehensive course, because for some people, the course I've developed, they're just saying, you know what, it's too much for me, especially people that have a lot of fibrofog. So I'm working on what I'm calling my beginner's neuroplasticity course. And I've completed my part, but there's a huge process to actually getting it online. So it's going to be shorter and much cheaper, and much pared down, so it won't have, like, not everyone apparently is like me and loves to know the science. So my current course is pretty science heavy. It explains the research behind everything that I'm recommending. The new one is just going to be, just do this. And it'll probably launch in, I'm hoping for April for that one. So that's what I have available. You know, there's lots of other people out there in the world who are teaching things. What I would say maybe sets me apart from some of the other courses, one is that everything I'm teaching is science-based, as you heard today. And I'm what I call agnostic. So a lot of the courses out there have a certain theory that they attribute everything to. So for example, by Grace, thank you for your interest, and we will be wrapping up. So for example, there's a lot of courses that think that all chronic pain is due to emotions. Okay, I do not believe that. I think emotions play a role in some people more than others, but I can't reduce everything to that. So my course is saying, or my approach is saying, here's how the brain works. 2 neurons can't do the same thing a neuron can't do 2 things at once. So every time you make a choice, you're kind of overriding pain or overriding your symptoms. That's hardcore biology. I'm not making any assumptions about what caused your pain. And so what I found is my approach works pretty well for almost all types of chronic pain. Many of the other programs that are very emotion heavy, they just don't work for people that don't have emotional problems, for example. So someone's asking, what if fibro is genetic? So almost certainly fibro has genetic risk, right? We know that. There's a ton of research showing that, yes, fibro does run in families and also runs with depression. So there are some genetic similarities and overlap between fibro and depression. So often, if you take a bunch of people with fibromyalgia, their family members are more likely to have depression and vice versa. But what we know about the interaction between nature and nurture, so nature is what we get in our genes and nurture is what happens to us in our life, is that what happens to us in our life in almost all cases is far more significant and impactful than our genes. So the general, of course, that's not true. If you have the Huntington's gene, that's like 100% penetrating, very impactful. But for something like fibromyalgia, the balance people talk about is 70-30. So maybe 30% is the vulnerability we get from our genes, and 70% is what's happened to us in our life. And now that we're adults and we have the capacity to learn information, the capacity to change our approach is part of that 70%, right? So many of us had very unfortunate things happen to us that may have led to us being in this position of having chronic symptoms. But now we have a choice. So this is like a decision point, right? Knowing what you now know, you have choices as of today. What do you want to do tomorrow? What do you want to do later today? What is your best tip for snapping the brain out of the repeated cycle, getting depressed, chronic fatigue? I know change is good, but I feel like I'm running out of options to change the cycle. So what I would say to Tracy, who came late, is watch the recording, because I go through that in quite a bit of depth. And on my webpage, in the About Me tab, so those who are here at the beginning, I told you that my travel photos are on that tab, but there's also a drop down there called free videos. And so I've given a bunch of talks on this topic over the last couple of years, and they're all freely available. So in each talk, I kind of focus on different things, and you may pick up some things, some extra tips that you didn't get in this talk. So my website is, okay, instead of saying it, I will. So I'll give you my website and my email, and you're welcome to email me with more questions. So that's my email and my website. So before we close, any last question? Really appreciative. It's always fun to talk to a new audience. So I hope it hit home and that I've given you hope that it is possible to have fewer symptoms. It is definitely possible. So I'll leave it there.
On behalf of myself and the Fibro Alberta group, we sincerely thank you for taking the time to do this today. Thank you so much.
Welcome. Thanks for the opportunity, because that's kind of what I'm doing now, right? Is trying to spread the word that there's hope.
Yeah, anytime. You're more than welcome. Thank you.
You're welcome.